All right.
Good morning, guys. I know it's early, so you guys are tired, but I want to take a moment of your guys' time. So I'm here to discuss with you a topic that affects you, that affects your children, or your future children, something that affects all of us. When we live in a world where the most important thing is life, then we must begin to rate the healthcare system that is providing the safety of that life. People all over the world are fighting for survival. And for some, survival comes easier than it may for others. But I am not here to bore you of matters of progressive evolution. I'm here to discuss with you the matters of our healthcare system and the role it plays as a protector of human life. Healthcare in the U.S. is different from other healthcare systems developed around the world. The U.S. is not a fully publicly funded country with healthcare, but in other countries, like Japan, full funding universal healthcare is provided to every single citizen. Healthcare in the U.S. compared to other countries, such as Japan, is ridiculously absurd and insensitive towards human health. America has an unbelievable number of Americans living without health care coverage. Because conservatives believe in the unstable system and freedom of choice, for instance, a politician may say that people should have the right to pay better health care. Maybe they would argue that the universal plan is just a socialistic view which is placed into action and would hurt the U.S. economy. John McCain, candidate for the previous and recent 2008 presidency, believes that universal coverage is an unrealistic view that should not be practiced by the U.S. government and public. He states, "I offer a genuinely conservative vision of healthcare reform, to preserve the most essential value of American lives, freedom." Despite the reasons, 47 million people live without health care coverage, and that number alone is larger than the population of California itself. California is the #1 ranked population of the U.S. with a population of 36 million. Other politicians argue universal health care is not a socialist view, that if it were to be placed into action, that it would benefit people more, or at least equivalent to the population of California. That it is unconstitutional that people living without health care are not to receive their rights that are promised in the preamble of the Constitution, the promise to promote the general welfare. Barack Obama, Democratic candidate for the most recent previous 2008 presidency, rhetorically states, "How do we build a movement for change that when a president is elected, that there is actually a constituency and a consensus that is built so we can move the healthcare agenda through Congress?" Whatever outrageous problems the U.S. is having about healthcare systems, Japan is not. Japan, remarkably, has one of the greatest healthcare systems in the world, the highest life expectancy on the planet, but this is because Japan has an outstanding universal healthcare system that provides every citizen with healthcare coverage. Not one person is left without health insurance, and medical prices are the same for every single person throughout the country, despite which hospital they go to, states PBS Frontline. This Japanese healthcare system is amazing compared to the U.S. There are 190 countries in the world, and the U.S. ranks number 37 by the World Health Organization, recorded by the Health Organization report established by the UN to rate countries from best to worst healthcare system. The U.S. ranks 37, and that is worse than some third world countries like Colombia, for instance, who ranks number 18. For example, Colombia is infamous around the world for disease and poverty. The Encyclopedia of Nations organization wrote an article stating many Colombians suffer from intestinal parasites, malnutrition, formerly a very serious problem with nutritional goiter, anemia, scurvy, and pellagra. Notwithstanding Colombia and the U.S., Japan succeeded the rank of number 2 in the Health World Organization report. This is quite interesting to consider, being that Japan is the second richest country in the world. Despite their lack of natural resources, PBS Frontline, the U.S. is the first richest country in the world, yet the U.S. lacks ambitions in regards to improving their healthcare system. Americans are sadly becoming extremely bankrupt. An article written by the CQ researcher states that the U.S. medical costs have more than doubled over the last decade, and health insurance premiums have risen nearly 5 times faster than wages. Americans are spending far more on health care than residents of any other industrialized country while receiving lower quality care. It is baffling that the U.S. government can allow this extraordinary high medical cost to rise. If there's one thing that can bankrupt America, it is healthcare, warns U.S. Comptroller General David Walker, chief of the Government Accountability Office in Congress. Naoki Ikegami, doctor from Keio University in Japan, states, "No one has ever been in medical debt because that would be an illegal scandal." A very interesting statement compared to David Walker's statement. The Japanese medical ethic is phenomenally superior to that of the U.S. Furthermore, their ethics display the value that they have their citizens' lives. Though the Japanese have amazing healthcare coverage, their doctors are not paid as much as U.S. doctors. Because of the extremely low cost of medical care and treatment in Japan, doctors do not share the luxuries that American doctors have. But they don't have to pay for outrageous prices of medical schools or for health care, unlike doctors of the U.S. Regardless of their wages, they provide a common good for all people in Japan. Also, because their wages are virtually the same throughout the country, there is no need for unbelievably high medical bills for competition. Healthcare in the U.S. is different from other healthcare systems developed around the world, and many Americans would love to see universal healthcare system develop here. The U.S. is not a fully publicly funded country with healthcare, but in other countries like Japan, full funding is provided to every single citizen. Healthcare in the U.S. compared to other countries such as Japan is ridiculously absurd, insensitive towards human healthcare because it lacks the concern for those who don't have any money, and for children born in poor conditions. It is not a child's fault for the condition in which he is born. Countries like Japan, whether they know it or not, are subconsciously preserving life, and that is it is morally time that we do the same. Is one man's house, car, or possessions worth more than a life? Should a salary going from amazing to good be the determining factor for 37 million people's constitutional welfare? Japan has a system that works. They have the highest life expectancy in the world and are still economically sound. In fact, they ranked number 2 in the world as an economic power. We live in a world where the most important thing is life. Then we need to begin to rate the healthcare system that is providing the safety of that life. People all over the world are fighting for survival, and some survival comes easier than it does for others. But I am not here to bore you with matters of progressive evolution. I am here to discuss with you the matter of human healthcare and the role it plays as a protector of human life. Thank you.